Even though CPOE or computerized prescription order entry is pretty common at a lot of facilities now, emergency departments still function primarily on verbal orders. So having somebody at bedside and just listening to what comes out of the physician's or the nurse's mouth is incredibly important, because they could be thinking one thing but say something completely different depending on the stress factors that are going on in the emergency department that day, because it's usually high acuity, high volume, and it's open 24/7. So it's very easy for somebody to misspeak. So that's an extra place where pharmacists can come in, is just listening for verbal orders and capturing them, because again, it's easier to capture them as they happen versus after they've already happened. Another place to think about capturing them is with educating your nurses, because even though you may be working at bedside, given the number of patients in the emergency department, if you've educated the nurses on doses and common medications, they're more likely to capture them as well for you, and they'll call you before they give a medication to a patient, and they'll say something along the lines of, "This doesn't look or sound right to me, what do you think?" And so then you'll know where to go next and talk to your nurses. So educating different practitioners in the emergency department is also very helpful as well. Preparation is also critical, because a lot of the medications may not be in the emergency department, they may come from the central pharmacy. So again, making sure that medications are prepared properly, and one of the big initiatives is to try to decrease the amount of medication preparation that happens at the bedside, or to put safety mechanisms in place, whereas if something needs to be prepared at the bedside, that it's done appropriately, diluted correctly, and the dose is appropriate before it goes to the patient, which is again where having a hands-on pharmacist in the emergency department is incredibly important.